Welcome to the SMA podcast series, A Day in the Life, a publication of the Southern Medical Association's Physicians in Training Leadership Working Group, composed of medical students and residents, whose mission is to provide a forum to plan and design new educational activities for physicians in training.
Thank you again for joining us for another episode of the Southern Medicine Podcast. I'm your host, Dylan Stevenson, and today's podcast will feature medical students from the University of Texas, Rio Grande Valley, that will share their perspective on working in underserved communities. Panelists, if you don't mind, please take a moment to introduce yourself.
My name is Macaulay Ojaga. I'm a fourth-year medical student at the University of Texas, Rio Grande Valley School of Medicine, and I'm applying to surgery this upcoming cycle.
Hello, everyone. My name is Annalisa Lopez, and like Mac, I'm an MS4 from Southern Texas here in the Rio Grande Valley, and I'm applying for plastic and reconstructive surgery.
My name is Sahar Pinjwani, and I am a third-year student here at UTRGV School of Medicine. As of right now, I'm not quite sure what I'm interested in, but I'm hoping to figure that out this year. But hopefully maybe something in pediatrics or OB-GYN, but we'll see about that.
Hi, my name's Elizabeth Lim. I'm a fourth-year medical student at the same school that everyone goes to, and I will also be applying to general surgery this year.
Awesome. My name is Alan Fonseca. I'm also a fourth-year medical student at UTRGV School of Medicine. I will be going into internal medicine.
All right, let's get started. What made you choose to attend a medical school that is centered around serving underserved communities?
I think a big part of my decision to go to a medical school that really focuses on serving underserved communities was that I didn't just want to learn medicine. I didn't want to just learn the clinical aspect of it. You can get that anywhere. What I really wanted to know was the social determinants part of it, the public health aspect of it, and how I could play a part in helping patients get access to healthcare that they might not normally be able to get. And the area that we're in, the Rio Grande Valley, has some of the highest rates of obesity and diabetes in the nation. And a lot of our patients are uninsured, they're undocumented. So we have all these unique challenges that we have to work around when we're trying to treat our patients. So a big part of making this decision for me was just being able to find some place that I could address patients in a more holistic manner and not just look at their disease, but rather look at their circumstances and look at where they're coming from in their background and work to be a culturally competent physician that could then help them combat those social determinants and provide access to healthcare. And that was a big part of why I chose to come to the school.
This is Elizabeth, and so to add on to what I think Sohar described perfectly, like exactly on the dot, on the head, uh, I think it also has a little to do with personal reasons, because we're all from very different parts, not like just of the world, but just in parts of life, I guess, and different situations that we come from, and so kind of, I guess, realizing what we can do for what people have done for us, kind of giving back in a way, and then also trying to empower the communities that can be empowered. Um, and I think what you'll find is there's a lot of opportunities in underserved communities for people to come and create something really cool and innovative that directly involves the community and gives back in a direct way. And so I don't know, there's lots of opportunities, I think.
What are the main differences you've seen in medical services provided between this community and that of a more resource-rich area?
Yeah, so for one, down here in the valley, we have a lack of specialists, and often many of our patients that are treated down here, for like more complex issues, these patients need to be transferred to bigger medical centers like in San Antonio and Houston. So oftentimes this can raise a bunch of issues because a majority of our patients down here, for one, are undocumented. I'm not sure if you're familiar with this area, but about 60 miles north, in order to leave the valley, 60 miles north, about an hour drive, is the Falfurrias border checkpoint. And pretty much you cannot cross that checkpoint unless you're a citizen and they ask you if you're American citizen or not. So that raises more issues because we have patients who, for one, are unable to go to Houston or cities like San Antonio or Dallas, Austin to receive care because they're undocumented. I can recall when I was working at my pediatric rotation at Driscoll Children's Hospital in Corpus Christi, one particular patient that I was rounding on and cared for my time there, I was talking to the parents, and the parents, well, it was the mom, and she was saying how, my husband is down in the valley and he can't come up here. I was like, oh, why not? At first I didn't understand the situation, and then after some more conversation, she told me, that they're undocumented, and if she goes back home or her husband comes back up to Corpus, there's a risk that they may get caught at the border and be deported to Mexico. So, and it's really sad because this happens like a lot more than you think. And it just like raises the issue of, like the lack of healthcare down here. So for big cancer patients too, all of our cancer patients that need complex treatments are sent to MD Anderson in Houston because of the lack of specialists down here to take care of them. Annalisa, did you want to add anything to that?
Yes, just piggybacking off what Mac was saying. Mac and I are actually both from the Valley. We were both raised here, so we're very familiar with, I guess, the sort of hurdles that people from underserved communities have to overcome. And I think that one of the things is having us both live here, I think we both didn't quite realize, or at least I'll speak for myself, at least I didn't quite realize how much it affects patient care until you see it on the day-to-day. When you see patients that have progressive illnesses and types of cancers that you really don't see in more urban communities, and it's because of the lack of access to specialists or the fear of seeing a specialist because if something comes up that's complex, now you have to travel up north and you don't have the papers or the resources in order to make that distance. And so instead, a lot of patients basically try to just hope for the best that their illness will either become steady or maybe go away. And it's an unfortunate reality that a lot of patients in this area have to face. And this is something that we really wanted to bring awareness about because there's a lot of communities in the United States just like ours, and we're hoping to help raise awareness for that.
How do you feel the lack of access to resources affects this patient population?
I think that's a great question. And I think I'll bring it back to like very, very kind of basic levels that I think we take advantage of. And one thing that comes to mind is access to transportation. Especially nowadays where it feels like a lot of people have a car or have multiple cars and it's so easy to just get around, but we forget that we have places like colonias, which are neighborhoods without basic needs like electricity or sewage or safe housing or anything like that. And a lot of times people have issues having transportation not only to their jobs but like to healthcare and for school and everything like that. And so I think that really impacts a lot of different things because that limits what people can go to. So, for example, if someone has to choose between picking up their kid from work because there's only one car and then picking up their husband versus going to get a checkup, or somebody that doesn't have a car and they have to ask for a ride. And this actually happened during my psychiatric rotation. We had a lot of patients who would come for mental health care, and they could only come if they had a neighbor or a friend who could drive them there. And when they didn't, they would have to miss their appointments. And that's kind of scary, right? Because mental health issue, we've all heard, and it's been brought to the forefront how much it affects and kills people. And so to see people's access to what could potentially save their lives, that's determined by the fact if they have a ride or if the bus can come at a certain time. I think that kind of speaks to the level of how lack of access to resources affects the community. And kind of talking about colonias in general, even housing, that's an issue. And we're kind of seeing that now with COVID, right? So we were telling people, quarantine yourself, self-quarantine, stay away from everybody. But if we have a huge family living in a very small house, that might not be possible. And that might result in like 14 members of the same family becoming infected with COVID just because of the fact that social distancing is not as possible or applicable as it would be in just like a normal, even an apartment where there's different rooms, and so kind of stuff like that. Mac, did you have anything to add?
So great points you made by Liz there. Some things I wanted to add. So underserved people one, they're more likely to have poorer health status. Two, they're less likely to receive medical care. And three, when they do receive medical care, it's often late. So as we all may know, late diagnoses for something as like complex or severe as like cancer is kind of like it's life or death, right? Because if you are hesitant to go to the doctor for any of these reasons and you show up with a stage 4 metastatic cancer, it's untreatable at that point. So these barriers to healthcare also include the high cost of healthcare, the inadequate or no insurance coverage. A lot of the residents in the valley are uninsured, unfortunately. The lack of availability of services, and also the lack of culturally competent care. These barriers also lead to unhealth health needs, delay in receiving appropriate care, and the inability to get preventative services, and ultimately leaves a financial burden on the patient, which makes them much more reluctant to go to the doctor the next time they have any issues.
Why do you think the COVID pandemic has had such a profound impact on this type of population?
So I think there are several factors that play a part in why COVID has been so rampant down here. And I'm on my family medicine rotation right now, so we've been seeing a lot of the effects of this. And one thing is that a lot of the people down here live in such close proximity. You have family households of 7 or 8 people that live in 1 or 2 bedroom apartments. So if one person gets sick, everyone is exposed, everyone gets sick. And this is something that we've been seeing a lot of, that we have family members who have multiple people in their households that have COVID. So they've obviously been exposed, and they all have to live in the same household. So we're finding that there's a lot of people just getting exposed from one incident like that. Another thing is also, outside of just healthcare, looking at all the other factors that are also affecting people in this area are things like, lack of access to internet or lack of access to resources. Like today, I was talking to one of the staff members at the clinic who was talking about how she doesn't have internet at her home and her daughter is going to be doing virtual learning for the rest of the year. And she doesn't know how she's supposed to get her daughter Wi-Fi access because they live in such a rural area where internet companies don't come out there to put internet, or they don't reach out there. And so she's trying to figure this out. And the school district is offering these Wi-Fi buses at their schools to allow students to go and use the Wi-Fi, but they're all during hours that the parents are working. So you have these unique challenges that are in place that are hard to tackle, and are really affecting these populations because of everything that's going on with COVID. And Annalisa, did you want to add anything?
Yes, I do. So something that I think that we've been throwing around, certain terms like underserved or colonias. These are things that we know on the day to day because these are the patients and the patient populations that we work with. But I just kind of wanted to define it for everyone, just because I feel like this isn't common to too many areas. So I think most of us understand underserved as not having access to healthcare, but there are particular communities, not just in South Texas, but across the United States, that have these areas known as colonias, um, which is basically substandard housing that lacks basic needs such as access to clean water, electricity, paved roads, drainage systems, as well as waste management systems. And so, as you can imagine, with people that barely have access to basic human needs, whenever something like COVID does hit, they're affected even more so because if they didn't have access to healthcare, let's say due to transportation at the get-go, well, now they're definitely not going to be able to have access to transportation or to see the doctor if they weren't able to already. Um, so I just wanted to go ahead and define that. And I also wanted to say that I think when we think of chronic health conditions or the health of patients, we like to think of everything in the chronic of, oh, this patient already had untreated diabetes, hypertension, all of these comorbid conditions, metabolic syndromes. But the real truth of it is that it impacts at the very beginning at birth. And I mean, it's kind of crazy how even during my OB-GYN rotation, I mean, poverty really begins at birth. You have no access to wellness visits for pregnant women. The pregnant women don't have adequate nutrition. They can't be counseled or have the usual visits that most women are able to have. So even at a baseline, um, these babies and these infants generally have poor health outcomes because of that. And then when you add on the chronic stress of not having access to proper water or proper food or even a place to walk down the street with your kids, that's just added psychological stress in combination with rough neighborhoods or um, sort of gang related violence. It really all adds on to someone's physical and mental health. And then when you compound something like the COVID pandemic, I personally do think that that's why the reason why this population is suffering so much and why we see that the Valley, and I'm sure places like the Valley, have been so heavily impacted by this. And when you think about it, when you start off in this patient population that's already scared to see an authority figure because of, let's say, lack of documentation, I think that it's daunting for the regular day-to-day patients that have a formal education to go see a doctor because it can be daunting with the medical lingo and everything like that. And when you think about how that's applied to somebody that already is feeling apprehensive about that sort of authority figure, it really leads to poor health outcomes. And it's something that I'm really hoping that in the future we can help to combat either with health fairs or more use of promotoras or something of that like. And that's just something that I wanted to add in on.
That's great. And I just to finish that thought, that was a great thought, Annalisa. Um, I think a lot of people may think that the people that are most affected by COVID down here are people who, without the resources or without the specific documentation. But I think that um, this community was ripe for how COVID kind of just is burning through it right now. And I think it's affecting the everyday person currently right now. So, for example, people with higher risk and higher morbidities, hypertension, diabetes, obesity are the ones that are higher risk for being hospitalized. But right now, even if you don't have those comorbidities, even if you do have insurance, even if you do have transportation, a lot of the hospitals are at max capacity or over max capacity right now. So if you get sick or a family member gets sick, and even though you have those resources, your care is now going to suffer a little bit. Ideally, it wouldn't, but with the hospitals being completely full right now, I think it's just natural to think that um, you could probably possibly get a little less comprehensive care just because everybody's completely overburdened right now. So I think it's important point to know that this isn't just affecting the underserved person, but this can be affecting the person with insurance with through a job, and I think that's such an important part of why we need to make sure that we take care of the most vulnerable, especially here in the Valley, because it extends to other parts of Texas and other parts of the United States right now. Because a lot of resources are being shipped throughout the state to the valley right now because we were again so right for this COVID pandemic to kind of cut through us right now. So that's an important point that I wanted to make.
How has working in an underserved community changed your approach to your future practice?
Yeah, absolutely. So, I think one of the themes of this conversation is that, we're in a medically underserved region of this country, and it's possibly one of the most, if not the most, underserved medically regions in the country. So, as medical students that third and fourth years on this call, we've seen, high rates of poverty, obesity, limited English proficiency. Um, and I think this plays out to create more empathetic student doctors and eventual clinicians when we get out of medical school. We see how this changes people's lives, especially through COVID. This isn't, unfortunately, for a lot of people, you just don't get sick and get better. I think the more and more research comes out, the more side effects you see from COVID, whether it's heart disease or lung disease. So just seeing that and seeing how vulnerable this community is, and it kind of humanizes things even more because you're able to see, younger people and mothers and grandmothers, grandfathers suffered through this. So although we this conversation is kind of realistic in the sense of cutting through a lot of the realities that are down here. I think one of the pros of being down here is that you're able to see the humanity and people. You're able to see how it's affecting you and affecting them, and it hopefully makes you a more empathetic practitioner, clinician in the future, and you're able to connect with people on a deeper level.
I think it's important to realize that one way to kind of overcome these barriers and help fix these issues is to really be advocates for patients, and that is not it's not only in one specialty or one lane that it's limited to, and that it should apply to all specialties, whether it's family, internal surgery, or OB, or anything else. It's we all have a part, because social determinants of health really impacts every part of a patient's life. For example, in surgery patients, the less resources you have, it's been found to be associated with higher complication rates and higher mortality. So it affects every specialty. And to kind of, I guess, give a story, is when I was on my OB rotation, we had a patient who was a high risk, and so they had to go get transported to Driscoll, but I mean, only they could go because they couldn't afford, only the patient herself could go because she couldn't afford, her husband or anybody else to come with her. So it's not just limited to one specific situation or issue or, specialty. It's very diffusely embedded in our medical system and health system as a whole. And so it's to not only acknowledge the difficulties that are being brought up, but it's to then say, well, then how can I help it? What can I do to help fix it? And that's really going to depend on every physician and surgeon that sees patients, honestly. And so it's just, what are the next steps, and how can we try to make things better? And I think the next question will kind of go into that deeper.
How do you feel medical students can act as an advocate for this type of patient population?
I think one of the cool things about being here, especially in the newish medical school, I think we're 5 years in now, but it's still a relatively new med school, is that you're able to kind of get your hands on with the groundwork with a lot of different organizations. Specifically, um, I was fortunate to be part of the student-run clinic down here, and we were able to see a clinic be built essentially from the ground up, and specifically inside of Colonia, which Annalisa nicely described. And you're able to see the patients in your first and second year, and you're able to make an impact right off the bat. So I think that experience kind of just gets you ready to become an advocate for your patients, and it primes you to make sure that you're making a change right out of the bat. And especially starting so early in your medical education, it only kind of like reemphasizes how you're going to be as a clinician and when you're practicing out there. So yeah, so making sure and I think Sahar is going to touch a little bit about some of the things that the student run clinic did, but yeah, I think just kind of just embedding that in someone early on in their medical education is so important, just because at the end of the day, as clinicians, we're here to help people. We're here to care for the community and make people's lives easier through not only medicine, but lifestyle, and making sure, as I was alluding to earlier, like a healthy community is not only good for the person that's going to get sick, it's really important for everybody else, and to make sure that infrastructure is there. So yeah, that's pretty much what I have to say for that one.
Yeah, I can add on to that. Um, so I really like the student run clinic because it was a great way to be really hands-on from your first and second year and be able to see patients and really interact with the population down here. So you get to educate them on their conditions or anything that they're going through, and you get to provide care for people who don't have access to healthcare, which is really important, especially in a community like this. We also have interest groups through the school, such as Walk with the Future Doc, which is a monthly walk that students put on. And basically, we invite members of the community. Each walk has a theme to educate the community on. And you basically just walk with the members of the community so you can talk to them, learn more about them, and teach them more about how to take care of their health. Another really important way that medical students can advocate for their patients is through medical societies. So we have our local county medical society, we have the state medical society, the Texas Medical Association, and then we also have medical associations at the national level, like the American Medical Association. So you can easily write policy and work to advocate for your patients. So last year I was involved in something through the American Medical Association that worked on policy for um, putting immigrant rights education into residency programs. And that's something that we're still working on, but it's a way for me to advocate for patients in this population and be able to work to make it better and help combat some of the issues that the patients have here, which I think is really important and something that medical students should definitely take advantage of at this time.
Yeah, and if I can just, that was awesome, Sar. If I can just add, I think all the medical students listening and anybody else listening, attendings and clinicians throughout the field, I think it's so important to instill that early, as I was mentioning with the medical students. But just as some of the examples, I helped found the student run clinic, and some of the things that I learned through it was just you ingrain yourself in the community, um, and by making those connections with the community is able to trust you. The community is able to turn to you in these time of needs, like through what we're living right now, and you're able to leverage that to make sure you're getting as much help into the community and pump as much resources as you can in there. Um, I kind of just wanted to make sure that whoever was listening to uh, from my perspective down here in the valley, seeing how much of an impact it's helped out other medical students throughout, because I know that's one of the highlights for some of the second, third, and fourth years that have been able to participate through it, was able to work in the community and really affect people's lives that are day to day.
What do you feel is a main barrier to continuity of care in this patient population?
Yes, ma'am. So some of the barriers to continuity care in this population are things like, for one, lack of resources, such as like internet connection, stable internet connection, I should say, like cell phones, computers, laptops. So I bring this up because during the COVID pandemic, a lot of healthcare providers switched to the telemedicine platform. And I think what a lot of different providers found is that, a majority of their patients were unable to access telemedicine platforms because, as for one, they didn't have the stable internet, or maybe they didn't have a computer or a smartphone for a video conference. So these are all things that may act as barriers. In addition, lack of documentation may also play a big role. Patients who are undocumented may be scared to go to their physician office because maybe they're going to ask for an ID, or maybe the Border Patrol is going to be waiting there to take them in, so they just never know. Another barrier I think is also education. So according to the 2019 census, I looked it up for this call, about only 64% of the Valley's population actually graduated from school with a health literacy rate of about 58%. So a lot of these patients don't really understand the disease processes, and they don't really understand that drinking Coke and soda and eating out every day is why they're unhealthy. It's just difficult for them to comprehend that. And for the patients who do understand that, sometimes fast food or like the quick stop at like McDonald's is a lot cheaper than going to HEB or Whole Foods or Central Market to buy like the greens and the healthier foods. So I think all these things play a part. The lack of continuity of care in the Valley here.
I mean, Mac did a great job pretty much getting into is a lot of points I was going to talk on as well. But something I just want to go ahead and expand upon is something that I think is often overlooked, especially when it comes to minorities and their barriers to access to continuity of care. Is there's a lot of physician mistrust, and I feel like that's really a huge part of it, and it's something that's commonly overlooked. And what I mean by this is I think that for a lot of people, going to the physician is more stressful because now you're having to take time out of your work day, driving over there, making the arrangements, let's say if you have kids, and getting all of that sorted. However, for a lot of minorities, there's a lot of psychological aspects and barriers to that. So, speaking to our patient population, and I can speak to it even with family members, there's a lot of distrust of, okay, um, I don't have health insurance. I don't know if I trust this person who doesn't even speak my proper language. I can't even properly understand them because of the language barrier. How do I know that they're not going to just make things up and overcharge me? Why do I even need to have my blood pressure monitored? It's kind of those misunderstandings where they're already walking into it a little bit defensive because this is a different infrastructure than they're familiar with or that they're comfortable with. It's a different language than being comfortable with. And I think that that kind of creates a psychological barrier of its own. And when you compile lack of proper documentation, that's another layer. Is this person going to report me to immigration? If if I go because I have a cough, is it really worth it to have this person not only try to deport me, but deport me and my family and my children and my mom and all of that? I think that's another level. And I think that's really what comes into not only having that initial encounter, but also having those subsequent encounters. And I think it brings up a point as to why it's so important to have access to proper translators or to have cultural trainings and clinics, because if somebody, they've been avoiding seeking healthcare for 20 years, they go, nobody speaks their language, and then above that, nobody understands what they're trying to say when it comes to those cultural differences. And for instance, I can at least speak to Hispanic culture. There's a lot of herbal remedies that are used, whether it's for anxiety or like rashes, things like that. And if you go to your clinician and say, oh, yeah, I've been using this topical herb that a culandero gave me, then, and they'll give you a look like you're crazy or they don't understand, then that's another layer of judgment that now, even though you made it and you made that initial contact, now you're not going to want to go back to that person because you feel like they didn't understand you. And now that was a waste for them, in their mind, a waste of a copay, a waste of a medication pay when they were just better off pretty much being by themselves. And so that's just something that I wanted to expand upon because it's a really big issue that's often overlooked. You think about, the health literacy and the lack of health insurance, but there's really so many layers that build upon it. And I'm so glad that we have the opportunity to help illuminate these. So thank you for having us.
Thank you all for sharing your perspectives, and we hope to bring awareness to this important issue. Is there anything else you would like to add?
So from the bottom of my heart and all the medical students here on this podcast in the medical school. I want to thank all the faculty and staff who 5 years into this great school of medicine has helped the community out, and we couldn't do it without their help. We couldn't impact as many people as we've done so far without their help. There's been so many people, so many names that that's helped out the Valley so far, and we're super excited to be here 5 years in and continue to help out a very underserved area and happen to take care of as much people as we can. So thank y'all so much for everything else, the School of Medicine, UTRGV.
Thank you for listening, and stay tuned for more Physicians in Training podcasts. To view all of SMA's podcasts, visit sma.org/podcasts.